My name is Ojukwu Joy Ekanem from the Department of Nursing, Regina Saskatchewan Polytechnic. I'll be presenting a PowerPoint on depression for an assignment on mental health nursing. Globally, depression is a common mental health disorder estimated at 3.8% affected persons, with about 5% being adults and 5.7% being adults greater than 60 years old. According to the World Health Organization, about 280 million individuals suffer from depression. Depression is classified into 6 different types, but the most common form is major depressive disorder, which will be the focus of this presentation. Major depressive disorder is characterized by sadness, emptiness, irritability, somatic concerns, impaired thinking, which results in impaired functioning of the individual in their relationship, occupation, and education. According to the Diagnostic Statistical Manual of Mental Health Disorder, DSM-5, MDD is characterized by 5 or more symptoms lasting for at least 2 weeks, which includes depressed mood, anhedonia, feeling of worthlessness or guilt, suicidal ideation or plan or attempt, fatigue or loss of energy, sleep decrease or increase, weight or appetite decrease or increase, decreased ability to think or concentrate, as well as psychomotor retardation or agitation. Among these symptoms, the fundamental symptoms are depressed mood and anhedonia, which must either be present among the other symptoms presenting. The etiology of MDD is multifactorial, having both biological and psychological factors in play. And the factors predisposing an individual to MDD are female gender, which are more common among females, early childhood trauma, stressful life events such as the death of a loved one, family history of depression, mostly first-generation relations, comorbidities such as substance use and anxiety, as well as some medical conditions. The diathesis stress model of depression shows the interplay that occur between biology and environment in depression. An individual with a predisposition towards depression can become depressed in stressful life events such as a sudden job loss or the death of a loved one. Depression is a brain-based disorder associated with abnormalities of neurotransmitters and brain structures as shown by neuroimaging. The neurotransmitters that are implicated in depression are norepinephrine, serotonin, epinephrine, dopamine, acetylcholine, and GABA. Imbalance in these neurotransmitters in the brain results in depression. In a depressed brain, some parts are more affected than others. And the brain structures that are affected in depression are divided into the following: the prefrontal cortex, the limbic system that involve the amygdala, hypothalamus, and hippocampus, as well as the anterior cingulate cortex. The prefrontal cortex of the brain is divided into left and right side. The left is responsible for positive feelings, while the right is concerned with negative feelings. In a depressed individual, the left prefrontal cortex is the weakest part of the cortex that is affected. The limbic system of the brain is seen as the emotional nervous system, which is responsible for emotions, physical drive, sexual drive, and stress response, as well as the anterior cingulate cortex that's responsible for decision making, emotional regulation, error detection, evaluation, and select responses. In the case of overactivity of this anterior cingulate cortex, an individual is predisposed to negative error detecting state, which affects the overall state of the brain, resulting in depression. For this case study, The patient is Kendra Thompson, a 35 years old adult female who is a Caucasian and also a Christian, living in an apartment in Saskatoon, diagnosed with major depressive disorder, with a medical history that has been normal until recently. She has comorbidity of anxiety and STI, which is recently diagnosed, and also have a great support from her mother and friends. In assessing a patient with depression, therapeutic communication skills are relevant in order to create a therapeutic patient-nurse relationship. An example of therapeutic skills here are used here is restating. Restating is a clarifying skills that helps the nurse to gain additional information by restating what the patient says. Here, the patient says, "I can't sleep. I stay awake all night." In order for the nurse to gain more additional information, is to restate what the patient says by saying, "You have difficulty sleeping." So this helps the nurse to gain more information on what the patient is saying. Secondly, is attempting to translate into feelings. When the patient says, "I am dead inside," the nurse can respond by saying, "Are you saying that you feel lifeless? Does life seem meaningless to you?" By saying these therapeutically, the nurse tries to decode the feeling that the patient is trying to express. So the two NANDA priority diagnoses that are related to this patient is disturbed sleep pattern related to anxiety as evidenced by changes in sleeping, which is awakening earlier than desire. And the second diagnosis is imbalanced nutrition, less than body requirement, evidenced by patient's severe weight loss. The number one, disturbed sleep pattern related to anxiety, evidenced by changing in sleeping. The nursing goal here is that patient will sleep between 6 to 8 hours per night within 1 month of hospitalization. And the intervention is to encourage patient to engage in relaxing measures in the evening. Relaxing measures such as drinking warm milk, a back rub, or a tepid bath. These measures will help to induce sleep and relaxation for this patient. The evaluation at the end of this period shows that patient was able to sleep between 6 to 8 hours at night, which is the treatment outcome that was expected for this diagnosis. The second NANDA diagnosis is imbalanced nutrition, less than body requirements, evidenced by patient's severe weight loss. The nursing goal here is that patient will gain at least 1 kilogram in a week by help from the nursing staff and family member. The intervention is to encourage patient to consume small portions of high-calorie drinks, snacks, and food during the day and evening to boost appetite. The measure here is to ensure that the weight loss is minimized and also to reduce the incidence of constipation and hydration, which can predispose her to other health conditions. At the end of the time, the evaluation shows that the patient is able to eat properly. And the treatment outcome shows that patient was able to eat at least 3 balanced diets in a day. So based on the patient profile, Kendra Thompson is an adult female at risk for suicide with comorbidities of anxiety and a recent diagnosis of STI. So incorporating her profile into the care plan, the support of her mother and friends were advised and encouraged in this care. So the intervention was focused on targeting her inability to sleep and eat through encouraging the patient to engage in relaxation exercising like tepid bath in the evening or a back rub in the evening before going to bed, as well as eating small portions of food. This will help her to sleep properly, which during the day will help to boost her activities and improve her mood. The medications used for depression are prescribed based on their safety profile and patient problems. There are different there are 7 different classes of antidepressants approved for use in depression treatment. But for this patient, mirtazapine, a serotonin non-epinephrine disinhibitor, is used because of the patient's insomnia and decreased appetite episodes. Mirtazapine has a faster onset than other antidepressants. Before discharge, patient will be educated on what the medication is used for, how to take the medication, the side effects of the medication, and what to do when taking the medication. This medication acts by improving the mood and feelings of well-being, and also by restoring neurotransmitter balance in the brain. So as the patient is going home, the patient will be taught about the mode of medication administration, which is by mouth once a day in the evening to aid with sedation and also enable the patient to sleep properly. The side effects of the medication are dizziness, drowsiness, lightheadedness, sedation, increased appetite, dry mouth, weight gain, constipation, disturbed concentration, urine retention, among others. So the patient will be taught on this based on the fact that dizziness and drowsiness can affect operation of heavy machines or driving. So patient relations will be involved in this to help out in this aspect. So based on this, the patient will also be informed to notify the nurse or physician immediately if the following symptoms occur: increase in depression or suicidal thoughts, dysphagia, difficulty in passing urine, severe headache, fever and chest pain. Patient will also be informed to avoid alcohol consumption when taking this medication, as this can increase the adverse effect of this drug. Patient also will be informed to notify the healthcare provider before taking over-the-counter medication, as this medication can also interact with the effects of mirtazapine. Medication should not be discontinued suddenly. Patient will be educated to notify the healthcare provider to change medication if side effect becomes unbearable. And following, the patient will also be informed that the medication has some real adverse effects such as sexual dysfunction and hyperpigmentation, which can result from exposure to sunlight. And also, in case of dry mouth, the patient will be educated to use sugarless dosages or ice chips or water to relieve dryness in the mouth. So for the patient resources available for Kendra Thompson, the resources are community adult mental health and addiction services located at Queen Street. These services are available throughout from Monday to Friday, which she can call to book appointments whenever she needs to. And also counseling services by Teresa Geraldiga is also available to give counseling for depression, so which is also an available resource that she can access. Canada Mental Health Association provides a depression support group through visual. This is very convenient for this patient because she can always access this kind of support whenever she needs in the community, at the comfort of her home or wherever she is. In case of crisis, mobile crisis service provided by Saskatoon Crisis Intervention Service is available for Kendra Thompson to access whenever she's in crisis, as well as helpline by dialing 811 provided by the Saskatchewan Health Authority. These are services that Kendra Thompson can access during crisis at home, wherever she is. The following are the references. Thank you for listening.